Welcome to InSight. I'm Wendy Brokaw. For the last 15 years, Bridgeway Recovery Services has been a leader in providing treatment for people struggling with symptoms of mental illness, problem gambling, and substance abuse. Bridgeway has grown its vision into additional health services for their clients and patients. Think primary care, dental services, and so much more. Given their expansion, they decided a new name was called for that fit all they now offer. In March of 2024, they became Bridgeway Community Health. What does that mean? And what are they doing that meets what our community needs? Would you please welcome my guest again on InSight, Tim Murphy. He is the Chief Executive Officer of Bridgeway Recovery Services, now Bridgeway Community Health. Welcome back.
Thank you, Wendy. It's a pleasure to be back. Thank you for inviting me back. I enjoy your show, and it's fun to be able to talk with you again.
You just had a groundbreaking ceremony on your newest facility. Tell us.
We did. So last week was a big week. So on Thursday, we had groundbreaking for the Bridgeway Medical Center, which is a 22,000 square foot medical center that's being built right next to my current outpatient clinic on Front Street here in downtown Salem. So I currently have outpatient services there, and now we'll have a medical clinic that will have 34 medically managed detox beds, 7 sobering beds, and a primary care clinic, all connected to my current outpatient services. So we're going to have a campus that we call it Bridgeway Plaza, and we'll be able to provide extensive services for people that are struggling with what you just said, symptoms of mental illness and symptoms of addiction. And it's an exciting time.
Very much so. When can we expect the completion of the building and the offering of services?
Well, that's a great question. We had the groundbreaking last week. We expect to actually start on the whole construction process next month. We're going through the permit process with the city of Salem, and they're being really supportive, but it just takes a while to actually do that. And we expect to open the new center mid-2025.
34 beds.
34 medically managed detox beds, 7 sobering beds, and then an expanded primary care clinic where we'll be able to provide primary medical services, medication-assisted treatment, all for the folks that are enrolled with Bridgeway. It's great.
The design is beautiful.
Thank you. Yeah. What I've done for the last couple of years is we've slowly grown. So you mentioned the origin of Bridgeway, which is Bridgeway Recovery Services. I founded that back in 2009. Small little clinic on the north end of town. We knew that we wanted to expand. We knew we wanted to grow. And I've always had this vision of getting downtown in front of the community and being part of the community. So a few years ago, I bought a piece of property right next to the Union Gospel Mission, who's a strong partner with us. Love those guys. And it took about a year and a half to develop that piece of property. And now I have, I think, about 30 clinicians working out of there, providing both mental health treatment and chemical dependency treatment, addiction treatment, problem gambling treatment. All of our outpatient services are right in town with a big sign that's lit up all night long that says Bridgeway. And you may remember that I said years ago that I wanted to address stigma and bring going to treatment for mental illness or chemical dependency as normal as going to the dentist. And that's really part of the mission, is to really embrace that. All of us have some connection to people who are struggling with addiction, whether it's our own selves, our family, our friends, co-workers. We now know that everybody has some connection. And so let's do what we can to wrap services around ourselves, our community. And when we do that, we make our community healthier. And when we make our community healthier, we also make it safer.
That brings me to why the name change, but I'm beginning to think it has to do with who you really are and what you really do in the community.
Yeah, so when we started back in 2009, it really was about addiction recovery. So Bridgeway Recovery Services was pretty much focused on that. But as we grew and expanded and our patients and clients taught us what they needed more of, primary care, dental care, connection to the community, housing, food resources. So we've grown to where we're more than recovery. We really are addressing the complete health needs of the people that we serve. So Bridgeway Community Health is just a natural progression for us, and we're really proud of it. And I'm really excited about the change. And it's brand. I'm not even used to saying it yet, but I'm getting there.
It's interesting because community health sounds like this is toward a healthy community.
Absolutely. That's what we all should be doing. All the partners that we have in our community, we're all collaboratively working together to make this a healthier place to be. And when I say healthier, I also want to say it's safer when we provide these services.
Who are your partners?
Oh, that's a good question. So a lot, actually. So I mentioned the Union Gospel Mission, Catholic Community Services, Valley Mental Health, Options Counseling, all of us working together in support of mental health and addictions treatment. And then agencies like Salem Health and Marion County Sheriff's Office and Marion County Health and Human Services, Community Action. We all work together in a variety of ways. We refer patients to each other when someone else has a better service that can fit the person that we're seeing, we'll send them there, and then they do the same with us. And Bridgeway is now the largest provider of addiction treatment south of Portland, north of Eugene, so in the mid-Willamette Valley. And there's lots of other folks that are doing that work. We just have gotten big. And we have a full range of services. We have the only detox. We're doing co-occurring treatment for people struggling with symptoms of both mental illness and addiction. Our provider group is duly credentialed in both mental health treatment and addiction treatment. So we've got a contract with Salem Kaiser Schools. We've got a counselor in every middle school and high school at least one day a week during the school year, just helping support the kids and teaching prevention so those kids don't end up as adults with addiction problems.
It's interesting. You talk about addiction problems. Everything from your website says problem gambling, for example, different kinds of addictions. Is there a base to the word addiction that applies to all these areas of addiction?
That's a great question. So what is addiction really? What's the compulsive behavior? So we sort of describe it generally as when you're involved in a behavior that is not in your best interest and you can't stop even when you want to. So despite the fact that you're getting negative occurrences as a result of your addiction, whether it's shopping and you're constantly in debt, whether it's chemicals, whether it's alcohol, whether it's gambling, when you can't control that behavior and you know that you need to and you can't, that's addiction. And so that's really what we help people do. We don't solve addiction for people. They solve it for themselves. Our role is just to help them figure out how to do that for themselves.
That's interesting. You don't solve it for them. They do.
Absolutely.
Why does that work over other addiction treatment methods?
Does it? Yeah. Addiction treatment methods historically have not really got a strong batting average, right? If they have a 30% success rate, they think that's pretty good. Well, I don't think that's very good. I think we need to get more at it. And so what we do at Bridgeway, it's not so much stopping you from drinking or using opiates or methamphetamine. I want to find out why you're using in the first place. What's going on in your life that has led you to start engaging in a behavior that's harmful for you? What is that? How is that serving you, if it's serving you? And so that's where we do the mental health overlay component, find out why you're using it in the first place and what we can do to help you understand that so that you can control your own behavior.
What is the process? Can you take us through your process for, you talk about detox, you talk about various ways that you go
Well, it
about it.
varies by, every individual. So
Really?
There's
no one size fits all.
No, if you've seen one person struggling with addiction, you've seen one person struggling with addiction. It's all quite different, and it really relies on that individual understanding that they need to get support and help. All of our programs are voluntary. There's no locked programs. We accept people who come in, and we help them design a treatment plan that they have a voice in, so they tell us what they think they need and what will be most helpful to them, and that's what we work on with them. So the voice of the client or the patient becomes the driving force of the work that we do.
What's key to somebody being able to take the reins of their own recovery?
Confidence, hope, optimism, and support. So when people come to us, when they're really steeped in their addiction, they've lost confidence in themselves. They also sometimes have lost hope. They don't see positive things happening. And so numbing themselves out with whatever they're choosing to do, whether it is any of those things I mentioned a minute ago, sometimes seems the best option they can come up with. So our work is to explore that with them, to see what they can do, what we can substitute to pro-social behaviors, pro-social work with the negative work they're currently doing, the self-harm they're doing through their addiction. And having that open conversation, that dialogue, it's different. And it's engaging in people, and it works for people, and that's what we've learned. And we didn't read that in a book. We learned it from the people that we're serving. We listened to those voices, and probably half of my staff at Bridgeway are people that are in recovery themselves, and we've gone and hired a whole group of folks that have lived experience, that they aren't necessarily trained as counselors, they're trained as peer mentors, or what we call certified recovery mentors, and their job is just to help support the person in addition to that counselor or therapist that they're working with. And so they see to it that they get to appointments on time, they listen to them when they're struggling, they might help them figure out how to access services in the community. We built a program called Bridgeway Community Connect, which is just a group of these people with lived experience. They've been there themselves, they've walked in their shoes, and they know that how to get hooked up for food services, how to get into housing, how to fill out an application for a job, where those jobs might be. And they, in addition to that person going to counseling and therapy, we also have this service that's absolutely free. And matter of fact, we actually open that Community Connect to anybody in the community that needs that kind of support. They don't even have to be a client of Bridgeway. We just provide that service for them.
Let's talk about some of your places. You are going to be having you had the grand opening?
So we had a groundbreaking of the medical center, but we had a ribbon cutting for a women's transitional home. It's called Lupe's house. And Lupe was a staff member at Bridgeway, one of the original people I hired, and her last role there was recruiter. And she recruited probably a third of my staff. She was very much, she used to say, cut me and I bleed Bridgeway. And she just was really a solid member of the community, and she passed away, unfortunately, young. And so we received some funding to open a women's stabilization house, and we opened the house in Kaiser just last Friday, and I named it after Lupe. So Lupe's house will be a support to women in this community that are transitioning from one level of treatment to the next level of treatment. So they've gone through our detox clinic, they're awaiting a bed in residential, they can live at Lupe's house until that bed opens up. So it gives them a safe, sober place to be in this interim period, and that's what stabilization means.
Why is that so important, that transition period?
Yeah, good question. So what we used to see, and why we built this service, and we're building another one for men too, is that people would come to us, get the detox, say, I want to go to residential treatment because detox just detox me. It's really not addressing my treatment and my craving. And they would get an appointment at a residential place, but it might be 2 weeks out, it might be 3 weeks out, and they would go back home or go back into the community, and there was just that high risk for relapse, and we saw that happen time and time and time again. And we weren't sure what to do about it because we can't keep them in detox for 3 weeks. That's usually about a 7-day program. So these stabilization houses give them a safe place to be, safe place to be centered, and we give them a lot of support, mentor support, those peer recovery mentors I talked about. They're with them while they're there, and then as soon as that bed opens up, they can shoot right in. And we expect that to improve their success in treatment and reduce the relapse rate.
And the Boone Road houses, what are those?
Okay, so we bought 2 houses out on Boone Road in South Salem. There's a well-known need for more residential treatment beds for substance use disorder. There was a big study done that said we were hundreds of needed beds in the state of Oregon, and so we wanted to provide more. We already have 2 substance use disorder residential homes, one in Salem that we call the Freedom House, one in Staten we call the Sandy Bloom House, and so we bought 2 more homes, and we've been calling them Boone, but really the men's home is going to be called the Pioneer Home, and the women's home is Magnolia. And so we hope to have the men's home opened in May of this year, so just in a couple of weeks. June 3rd is the opening day for the men's house. And then later in the summer we'll open Magnolia House, which will be another 5 to 8 beds for women with substance use disorder needs.
What's the vision for these homes?
Residential treatment, and more opportunity for people to access them. And it's not just for our local community. These can be accessed from people in high need around the state. And you're going to see more and more residential treatment homes open over the next year or 2 because there's been a push to build more services for people. Oregon has a pretty bad history of not having access to services, and so we're doing what we can in our community to mitigate that, and my colleagues around the state are opening up new treatment homes as well.
Why is it so hard to get these other services?
Well, it's hard for a couple of reasons. One is you need to put that house in the community where it's zoned appropriately. So you have to go through the zoning piece with your local community. That's what I'm doing currently with the Boone Road property. And then you need some buy-in from the neighborhoods, because people still have a stigma about, oh, it's an addiction house, that's going to harm our neighborhood. And actually, in most cases, it improves the neighborhood. I've been operating the Freedom House in South Salem for years, and the Sandy Bloom House for maybe 6 years now out in Staten with 0 problems. And so the need is here. We're just going to have to build them. And then funding, you need to be able to access the funding to pay for those services. And they're expensive because you have staff there 24/7, 365. So that means you have to have a significant group of folks that can provide those services, and you have to have people to feed them and all of the things that come with that. So we're pretty good at this. We've been doing it a while, and it seems like the natural thing for us to do is to expand the services, and we're really looking forward to it. We're pretty excited about it.
We were talking about Measure 110 being recriminalized. That's had an effect on you, and a big one.
So Measure 110 is probably worth its own show. And maybe you've even had a show for it. But if you think back to the original when Measure 110 got passed in the state of Oregon, passed with pretty strong vote not to legalize, but to decriminalize possession of small amounts of narcotics. And the goal of that was to keep people that had an addiction issue from being criminalized and having a criminal history and maybe having to go to jail. And there was a lot of positive support for that measure. And there were two components to Measure 110. One was the decriminalization, and the other was the transfer of funds from the marijuana tax accounts. So we legalized recreational marijuana in Oregon. We put a 25% tax on it in the state that doesn't have a sales tax, but it raised a significant amount of money. That money prior to Measure 110 was just being used in a variety of ways in a variety of communities. Measure 110 said all that money needs to be redirected to drug abuse treatment because we have a problem in this state and we want to fix it. So that was a good part of Measure 110. The decriminalization ended up with some unintended, really negative consequences, where we all saw some rather public people using drugs quite publicly, a lot of people accessing, drug use, but then also not ending up in treatment because there wasn't any way that law enforcement could push people into treatment because they had decriminalized it, so it took away their ability to encourage people to go to treatment. So we saw a little bit of reduction of people in treatment as a result of Measure 110. In this last legislative session, the legislature came together and said, we want to change this, we want to fix this problem. We see the financial support is been good, and so we're going to leave that piece alone. We're not going to take the money away from the marijuana tax money. We're going to keep funding that, but we need to look at what we did when we decriminalized. So they're recriminalizing, to an extent, possession of small amounts of narcotics. And every county is going to have their own process, and they're using this term called deflection. They're going to build deflection services that will hopefully push people into treatment, but not end up with them going to jail. And so those all have to be developed and put in place by September. The good news for our local community is there's been a program that the Marion County Sheriff's Office has been operating for several years now called LEAD, and that's Law Enforcement Diversion is what that is. So we're going to see them look at the LEAD program that we currently have and how they can use this deflection idea to help support people getting in treatment, but not necessarily create criminal records for them. So we'll see how that goes. No one quite knows how that's going to go yet, but what the legislature did do was we want to fix a problem, and it was one of those rare things where both sides of the legislature came together in agreement and did that. The other thing they did is they put a substantial amount of money also out into treatment. And so when I had this groundbreaking last week, Senator Deb Patterson has been a big, strong supporter of what we do at Bridgeway. She helped get a bill through that provided treatment to Bridgeway, along with Representative Kevin Mannix, who is, my clinic is actually in his district, and then Representative Ed Deal, who's out in the Canyon area, also a big supporter of, and those two are Republicans, Senator Patterson's a Democrat, and they all showed up along with Sheriff Hunter to my groundbreaking. I got pictures of them all standing next to each other with their shovels on the ground because they all see the value of what we're doing, and I feel really blessed to have their support. It's good people in our community.
I can certainly say a bipartisan effort is a wonderful thing,
yeah.
And very exciting to see happening with this new medical facility. Did Measure 110 unleash anything else unexpected that has to do with treatment?
Well, I mentioned the redirection of the marijuana tax money. So Measure 110, when they redirected that tax money, there was about $240 million that was raised in marijuana tax revenue. And that money got directed through the Oregon Health Authority across the state specifically to develop treatment facilities and treatment programs. So Bridgeway a couple years ago got some of that money to do that. This program I mentioned a few minutes ago, Bridgeway Community Connect, it's completely funded through that measure because there is no, you can't bill Medicaid, there's no insurance billing, it's a community service we're providing. And we looked at some other things that we thought the community would benefit from. For example, if you have an addiction problem, you have insurance and they'll pay for it, but family members that might live with you, they're also affected by your addiction problem. But they can't access treatment because they're not the one that is the patient. So we wanted to build a service to help them that there wasn't any revenue for. And so we asked the Measure 110 folks if we could use money to build a family service program to help educate kids and spouses and partners about what addiction is and how they can support the person and their loved one that's struggling with addiction. And that's been a really big success. So we're hoping to be able to continue that.
That's really interesting because you talk about that human connection with other people that is so key to making a person feel, I can do this, I can stop my addiction. But that extends to their family too. They're affected by it.
Absolutely. You can't, addiction isn't a solo disease, and it's not a solo pathway out. The people that are very successful in addressing their addiction and managing it well are the ones that have family support and community support and feel supported, and that gives them hope, gives them optimism. And I often think that addiction comes out of absence of hope and absence of love. And I give a talk every year about the cure for addiction is love. To be loved and to love someone and to be loved, what a wonderful feeling that is. Most of the people in my 35 years now of work with folks struggling with addiction will say at the outset that they're alone, they don't feel loved, they don't feel cared about, and so why not just drink myself silly on Friday night? So if we can encourage them and their families to reconnect and find each other. I mean, it works. It works.
What's your big goal?
Oh, a big goal. Well,
You've had the vision from the beginning, but I just see it incrementally actually coming true.
Yeah, when I talk with folks that work with me at Bridgeway, I was talking about having a campus for years, and then all of a sudden we have a campus. And then I started talking about, well, wouldn't it be nice if we had a medical center next to our campus? And now we're building a medical center. So I think that when this is all done, when we've done what we can do, then it's time to really, so the piece I talk about a lot is what we do is we're reacting to addiction crisis. People come to see us for treatment. We're reacting to the fact, I want to get in front of that. I want to start looking at prevention. What can we do to help people not feel the need to use, to not manage? We want people who have symptoms of mental illness, we want to help them figure out how to self-manage those so it doesn't interfere in the value of their life and the quality of their life. And I think that we as a community can get there. And I've been really lucky in the time I've spent. So I mentioned 35 years, but 32 of those have been here in Salem. And there's a growing awareness that addiction is a community response. And, you know, we've got employers now that hire people with histories of addiction. We have physicians that are feeling more comfortable treating patients with histories of addiction. We're seeing a little bit more acceptance of that work. Our law enforcement friends and colleagues are no longer seeing everybody that uses as a criminal, but seeing them as someone that's struggling, and that we ought to, you know, reach out and give them as help that we can. So we've redefined that need and redefine the definition of addiction, and it's a compassionate community that we live in. We're lucky.
And now you have Bridgeway Community Health.
Yeah, doesn't that sound good?
That sounds just right.
Good. Thank you.
Spot on.
Thank you.
Oh, Tim, it's always good to see you on InSight and catch up with you on all the new developments. And it's been, as I said, a very long pandemic. We haven't seen each other for a couple of years.
Right, yeah.
We'll see you again.
I look forward to it.
Thank you very much.
All right, thank you for inviting me. Pleasure.
And thank you for joining us today on InSight with Tim Murphy.